Hi, my name is Simajit Rai and I'm a nurse consultant in the breast unit at City Hospital at Sandwell, West Birmingham NHS Trust. Today I'm going to show you how to examine a patient's breasts and how to do a breast pain assessment. When to check. Many women examine themselves in the shower. This is fine, but once a month you should encourage them to use the correct method that I will now show you. The ideal time to advise the patient to check their breasts is just after their period, if they are still having them. If they examine their breasts before their period, they will feel lumpier and tender more than normal and they may worry unduly. If they are peri or postmenopausal, then ask them to pick a particular day each month and stay with that day for continuity. The exam. Stand the patient in front of you so you can see the breasts in their natural posture. Ensure that the lighting is good. Check for obvious visual abnormalities such as nipple inversion, nipple excoriation, peau d'orange or rashes. If the patient is large-breasted, then lift up the breast to see the lower half. Ask the patient to move from side to side and look again. Ask the patient to raise both their arms above their head and look at the breasts again, from the front and again from side to side. Do the breast change? Is there any dimpling to any part of the breast or pulling in of the nipple? If the patient is large-breasted, then lift up the breast to see the lower half whilst their arms are still raised. Check for any dimpling, puckering, peau d'orange or rashes. Ask the patient to put their hands on their hips and gently squeeze inwards and look out for any dimpling or pulling in of any part of the breast or nipples. If the patient is large-breasted, then lift up the breast to see the lower half while their hands are still on their hips. Check for dimpling, puckering, peau d'orange or any rashes. Once you've completed the visual checks, then ask the patient to lie down on the examination couch with the head of the couch tilted at least 35-degree angle. Ask the patient to bend their arms so their hands are resting above their head comfortably. Using your full hand, not the fingers, start examining the breast. There are many techniques you can use, just pick one that is natural to yourself and continue with it. I use the clock method as it's what I'm familiar with. Gently press and roll the breast, then move on to the next section. Ensure that you've examined the whole breast and the nipple area. If you feel something, then use your fingers to palpate for size, texture, and if this has been tethered to the muscle. Once you've completed the one side, then repeat the exam on the other breast. If the patient has presented with breast pain, please check if the pain is originating from the breast or not. Roll the patient completely on their side. Press along their ribs starting laterally. Ask them as you press on the ribs if they have pain. Bimanually press the breast together with your hands and ask them if they have pain. This will help distinguish if the pain is true breast pain, musculoskeletal pain from the ribs and chest wall or both. This will help reinforce your findings if you suspect that the pain is not truly from the breast alone. The last part of the exam can be done lying down or sitting up. Supporting their arm, gently press and roll your hand in their armpit. For any lumps, repeat on the opposite armpit. Exam is now complete. It is important to stress to the patient that the breast pain alone is not an indicator of breast cancer. There are other signs that patients should look out for to highlight to their practitioner. All women will experience breast pain, but there are ways in which it can be managed.